Hello and welcome back. So in this part of the lecture, we will discuss about toxoplasmosis in pregnancy. Is it what effect can it have on a fetus? So toxoplasmosis is actually it's a parasite. It's not a virus. It's not a bacteria. It's a parasite and it's an obligate intracellular parasite. Toxoplasmosis is caused by Toxoplasma gondii. That's the name of the parasite. And what do we mean by obligate intracellular is that it is completely dependent on the host to replicate, to reproduce. Like it's like virus, right? Viruses, all viruses, they need their cells, host cells. They cannot replicate outside the host cell. Same is with this parasite. Now, it's very important, especially for pregnant women, not to avoid cleaning cat litter, okay, because it can spread, they can get toxoplasmosis infection. So cat is the definitive host which produces different stages, sporozoites and oocysts. I'm not teaching you uh, parasitology, okay, but as you can see, this Toxoplasma gondii, its life cycle, definitely involves cat. It can infect pregnant women, which can then transmit it to the baby. And the stage of that parasite, that's the tachyzoid, which is transmitted through the placenta. Okay, but there are other stages in the life cycle, and it can live as a tissue cyst in say for example cows. Okay, so that means if we consume undercooked infected meat, then we can also get it. Okay, so toxoplasmosis is, I think, in the world top is France. Okay, so infection in fetus occurs when mother has a primary infection during or shortly before pregnancy. During active infection, these tachyzoids, this stage, okay, tachyzoids invade and replicate in the cells of the heart, liver, spleen, lymph node, muscles, and the CNS. So, in the baby, just imagine that it's a developing baby, and then it can invade all of these organs. So, what can happen? It can cause miscarriage, preterm birth, intrauterine growth restriction. It can cause hepatitis. It can cause low platelets, thrombocytopenia. It can cause problems in the brain. It can cause hydrocephalus, it can cause microcephaly, it can cause brain calcifications, intracerebral calcifications. That's a very important finding, okay? Intracerebral calcifications. And then it can cause problems in the vision of the baby, retinitis. There is a classic triad. So if there is chorioretinitis in a baby, newborn baby, if they have chorioretinitis, ultrasound we can see these intracerebral calcifications actually. Yeah, instead of intracranial, the better term is intracerebral calcifications and hydrocephalus. Okay, that's the classic triad. Now, okay, there is one thing which is transmission and another thing which is to getting infection. Okay, transmission means the it is transferred, right? But whether the baby is infected, that's a different thing. Okay, so see, we may be exposed to, say, for example, tuberculosis, but do we get it or are we infected? That's a different thing, right? So being exposed is different, but being infected is different. So the greatest risk of transmission is in the third trimester, but it does not mean that the greatest risk of infection is also in the third trimester. It's not like that, okay? So fetus infected at less than 20 weeks. Of course, the earlier they get it, like most infections, the severe is the outcome because that's when baby organs are being formed, cells are forming. So also more parasitic load in the amniotic fluid, more severe infection. So how can we see what is the parasite load in the amniotic fluid? It's by the procedure amniocentesis. Remember that whenever we have an infection, it should always be referred to a fetal medicine. Okay, so fetal medicine people do amniocentesis, they do chordosynthesis, though they do chorionic villus sampling. Okay, so fetal medicine involvement is mandatory. Okay, in all of these infections. Also, okay, so, and if amniocentesis is performed and if the parasite load is like beyond certain level, you don't need to remember the certain level, then offer termination of pregnancy. Now, in congenital toxoplasmosis, what can be the problems? There can be mental retardation because there are intracerebral calcifications. Babies can have blindness and seizures. Okay. And so the babies can have hydrocephalus, lesions in the organ of vision, which is chorioretinitis, cirrhosis of the liver, and enlargement of the spleen. So splenohepatomegaly. Now, how does the woman present? Sometimes it's just mild illness, right? Mild febrile illness, lethargy, malaise, lymphadenopathy. But say, usually all pregnant women, most of them, they feel tiredness. So most of the times, it may not even be detected. Okay. If we suspect and if we investigate, then first we will start with serology, so IgM and IgG. So as we said for the last part, rubella, that IgM shows acute infection. IgG means they are already exist there. Okay, so but they can be false positive. So if say for example IgM is positive, how do we confirm it? By ELISA test. And if amniocentesis was performed, then PCR is performed to confirm fetal infection. Okay, so we have some medicines. Okay, if there is only maternal toxoplasmosis, say for example amniocentesis was performed and it is negative, right? But maternal IgM is positive and ELISA is positive, then start spiramycin. Preferably start treatment in the first 4 weeks of infection. May not protect fetal infection. That's the problem. But if it confirms that amniocentesis confirms that baby is infected, then combination of sulfadizine and pyrimethamine, but pyrimethamine it's contraindicated in first trimester. Okay. So, but after consultation from the fetal medicine, even if this is amniocentesis is negative, okay, so spiramycin may be given with sulfadizine, but again, it's the fetal medicine department which deals with it. Some health problems in infected fetus may not appear till second or third decade of life. So even if a baby was born apparently normal, but later on they can have these issues. Okay, so how can we prevent toxoplasmosis? All women, regardless of whether they are intending a pregnancy or not, they should avoid eating raw or undercooked meat. Do not or minimal exposure to cat litter or contaminated soil. We can use gloves, but there is unfortunately no vaccine. So in the UAE, if you remember in the recommended list of booking bloods, yeah, we can do it, but insurance usually does not approve it. So in the UK and UAE, toxoplasmosis is not screened for routinely in pregnancy as part of the booking blood test, unlike syphilis and rubella. So we screen all women for syphilis and rubella, but not toxoplasmosis because insurance does not approve it. If the patient wants to, yes, of course, we can do the test as part of the booking blood test. Okay, and that's it for now. And in the next part, we will discuss